Hey everybody, my name is Dwayne. I'm again coming to you from Canada, just on here today just to talk about doctors. Well, what can I talk about doctors? Now, I want everybody to comment below who's also having trouble finding a good doctor for your chronic pain. Who is also having trouble trying to find a good lupus doctor or a good fibro doctor. We're not going to touch on the family doctor too much, but even then, who's even having trouble finding a family doctor? A lot of people are having the same trouble. Personally, it's very difficult for me to find a decent doctor that can actually help me and actually understand what I'm actually going through. The knee issue, I go see a doctor tomorrow regarding this problem, and I spoke to a doctor today, and anyways, but I'm hoping I did finally find myself a good doctor regarding an orthopedic surgeon regarding my knees. Now, as for your fibro pain or your chronic pain or anything like that, I want you to just comment below to tell me where you're located, and do me a favor before you do all that, subscribe to my channel, like my channel, and then you can even share all my videos. It's always shareable. Go ahead and enjoy it. But yeah, let's discuss this. Have you found a good doctor? I'm curious. I'm located up in Ontario, Canada. The thing is that doctors are very difficult to find that are good doctors. Some are excellent doctors, but trying to find them is a different story. Now, yeah, comment below. Tell me who your doctor is or your doctor's location. I want to find out where my videos are reaching also. And second, tell me if you've had issues trying to find a good doctor, or if you go, I'm not sure if you go to a chronic pain clinic or a pain clinic, or do you go to a rheumatologist, do you go to a pulmonologist, a hematologist? I'm not sure who you see for all your issues. Just give me a list of everything that you go through, or everything that you're currently going through, and tell me what the steps are that you've taken to find relief. Some people have gone to the black market. Some people have gone to even going to the streets for their drugs and their medication, and it's dangerous. Yes, I understand that, and I totally understand where you're coming from. If you do, or if you have gone to the black market or to the street for your drugs, I totally empathize with you and sympathize with you 110%. The thought has crossed my mind here too. The issue I've come across with my physician, that's all I'm going to use, is that I've been basically cut off for opioids. Now, long story short, I no longer can get opioids from my physician, and it's a big opioid crisis out there, and a lot of the big pharmas are cutting back on prescribing and providing this medication to everybody, which is really unfortunate because, like myself, it's very hard to function without some type of medication in me. I do take multiple types of medication that I purchased, that my girlfriend has purchased for me, to be able to function on a regular basis, and it still doesn't match up to the opioids. I've been cut off for about 2, maybe 3 months now, and it's by far the worst I've been ever. I was on opioids or oxycodones for about 8 years, between 5 to 8 years, and yes, I was on a high dose, but I could still function. My brain was clear, my energy level was up, everything was perfect. I could actually function and work. Now, due to not being on the opioids, the thing is that now I can't work right now. It's not because of the body pain, it's because of the knee pain. I'm not able to clearly think anymore. I'm not able to do multiple things anymore. It causes a lot of problems in different aspects of even just a relationship. Sorry, I'm just getting a piece of paper here as I go along. So, tell me what your feelings are about if you've been cut off, or if you're looking for any type of opioids or narcotics. I'm just curious. I'm not sure if I've been the only one that's been cut off. From what I see, there's millions of people out here in Canada that have been cut off due to doctors' inability to understand the patient. And that's the problem with doctors now, is that the doctors don't understand what their patient is going through. These doctors need to educate themselves on their patients, and research everybody that goes through, or common symptoms that all the patients go through, to be able to understand their patients. And that's the problem I've come across many doctors out there. Okay, I've been through well over 24 doctors, different specialists, so-called talk to doctors, and they're not really doctors, they're psychiatrists. They think it's all up here, and I'm sick and tired of it. And that's a big problem. It's not up here. It's not up here. So don't let anybody tell you you're going crazy, okay? That's all I'm gonna say. But the next subject on my next video, we'll be talking about probably the medication that, we'll go over medication, okay? I'm just writing that stuff down here. So we're going to go over medication and things that I take. And I think I covered it on my last video, but I'm going to cover it again just because I want people to understand it a bit more. And I'm going to cover the narcotics and opioids and find out what things are good and what things are bad. Again, I don't take any type of narcotics anymore, which has been a big problem. So anyways, comment below about your issues with your doctors. You don't even have to give me the name of your doctor. If you're okay giving it, that's fine. Just tell me where you're commenting from, or an approximation, closest city, whatever, and we'll just go from there. It's not difficult to spread the word out about your doctor and doctors out there that are making their patients suffer on a regular basis. And I'm one to come forward now to let people know that I do suffer, and I suffer from inexperienced doctors that are not educated on their patients. Simple as that. So I'm going to end this video right now on that happy note. Again, my name is Dwayne, latest mix worldwide. We're up here in Ontario, Canada. I noticed that my videos are reaching most continents out there, so I'm getting out to Africa and Asia. Come on now, I want you to subscribe to my channel, comment, please keep it clean, and then we'll just go from there. Alright everybody, thank you for watching this video. I'm going to post this shortly. Currently I'm doing a edit on my other video, and it's taking a little bit of time to edit. I'm hoping that it works well. And I think I've touched every subject for this one today on doctors. Okay, so this is my subject for doctors. Just leave a comment below, like my video, share my video, spread the word.